There have been extensive research findings that discuss the role unconscious bias plays in the healthcare field. These findings suggest that patients may receive differential treatment based on unconscious prejudices called implicit bias. What is implicit bias? Unlike explicit bias, which is the conscious awareness of a prejudice or attitude towards a particular individual or group, implicit bias is the unconscious negative attitude, feeling, or stereotype directed towards others based on their race, ethnicity, sexual preference, age, gender, weight, language, socioeconomic status, and even insurance status. So how does implicit bias affect overall healthcare? Well, implicit bias may affect clinical decision-making that can lead to reduced patient-centered care. Studies suggest that implicit bias has been associated with reduced provider communication, under-prescription of narcotic pain medication, underdiagnosis of conditions, stereotypes of patient adherence to medical protocol, unequal representation in clinical research, and reduced level of attention that a patient receives from a medical health provider. In nursing, implicit bias can lead to health disparities and poor patient health outcomes. While it may not be intentional, it is important to identify and reduce biased behavior. Now let's look at how implicit bias may appear in nursing. Some examples might include taking longer to do a nursing assessment for a patient who is of a different race or ethnicity, while unconsciously giving preferential care to a patient who shares the same race as the nurse. Asking a patient who does not identify as heterosexual if they are in the clinic for an STD test due to presumed risky sexual behavior. Insisting that darker pigmented skin is harder to give injections to based on the assumption that pigmentation affects skin thickness. Dismissing symptoms of pain from obese patients because it must be related to being overweight. Speaking louder than usual when providing care for elderly patients. Or not relaying a request for a referral to a physician because a patient is dressed poorly and the presumption is that they may not be able to afford specialty care. These are just a few examples of how nurse implicit bias may affect patient care. How do we overcome bias? The first step to overcoming bias is take the time to identify any biases that you may have. Project Impact has created the implicit association test that measures beliefs and attitudes related to implicit bias in a variety of contexts. This is an excellent tool to assess your own implicit biases. Next, consider the perspective of the patient. From their point of view, how does your treatment make them think or feel about the care they are receiving? Next, take your time. Try not to rush through a patient interaction where you may respond instinctively instead of thinking through if your response may be related to an implicit bias. While many healthcare settings can be fast-paced environments, taking time to ensure you are addressing any implicit biases can reduce errors and improve rapport. Finally, get to know the patient. You may find you are more similar than you think, and this can help reduce stereotyping.